everybody. We have spent some time talking on the program about enforcement of social distancing guidelines. We see from some of the modeling that Canadians have been listening to the social distancing guidelines to the point where the modeling has much better numbers for the first wave of the pandemic. For the end of the month here in Ontario, less than 20,000 cases now expected. That means, though, we have to continue doing what we're doing. We can't let up. For the people who are maybe having those moments where they are letting up, they are getting outside, there have been cases where people have been ticketed. There have been some stories recently with criminologists saying that some of these fines aren't necessarily the best method to achieve the goal of safety, of better health, of getting people to comply. We now also hear of the Canadian Civil Liberties Association saying it's going to fight for citizens nabbed for infractions during the pandemic. There is some research that has been done on this, courtesy of the Ontario Civil Liberties Association. Their researcher, Denis Rancourt, joins us now to talk about this. Appreciate your time today. Thank you very much.
Hello, Devon. I'm glad to be here.
When did you start looking into the response of the social distancing guidelines?
Oh, right away. I've been, as a researcher, I'm very concerned about this because there's a large potential for civil liberties, civil rights to be violated. One thing I'd like to say right off, though, is that I have to be critical of even your opening statement because this is not an evidence-based thing that we're doing with the general population lockdown. There is no study that demonstrates that it's effective. The statements to the effect that any gains are due to the lockdown are not at all demonstrated. This is a seasonally transmitted disease, and it's natural that the transmissivity would go down as we end the season. So none of those statements are actually based on science. And so what we did at the Ontario Civil Liberties Association is we reviewed the science right up to the day. And it demonstrates quite clearly that none of this is science-based, and that the disease itself is not any more virulent or doesn't propagate more quickly than the flu, than the influenza, which is already very contagious. But the death rate from it, the infection fatality ratio is very low. And this has been demonstrated by leading groups of researchers that are working, day and night trying to get these results out so that it becomes evidence-based rather than just, just fear reactions from the first deaths that were observed of very vulnerable people in homes and hospitals and so on. So our research is not at all in agreement that this is good social policy or that it's evidence-based.
So would the Ontario Civil Liberties Association then think we should not have these social distancing guidelines in place at all?
Well, the science that we reviewed actually demonstrates, there's an article that just came out in the very prestigious Science magazine by Kistler et al., just came out days ago, and it actually demonstrates by the most sophisticated modeling techniques that if you do a general population lockdown like this, you will have overall more deaths and more disease than if you didn't do it. And the reasons for that are twofold. You basically, by the lockdown, either the lockdown procedure is ineffective whatsoever, or if it is effective, what it does is it so-called flattens the curve, which means that you delay the societal immunity. Now, when you delay the societal immunity like that artificially by this method, and then people go back to their usual lives after that, the next wave of infection is actually greater. What they showed is that it's greater and more deadly than what you tried to prevent the first time around. Now, this is Science magazine. The top leading groups are saying this. So if anything, the leading modelers of actual peer-reviewed research, not just government white papers and things like that, are saying that this is a very dangerous thing to attempt. It's important to note also that this has never been attempted in modern times. A general population lockdown has never been attempted or demonstrated to work or studied by field studies to be a good thing. You have to distinguish between quarantine methods and general population lockdown. Quarantine is what you need to do to prevent, if once you've identified that someone's infected, you prevent it from spreading by quarantining the household or the institute. You want to protect the elderly and the vulnerable people, the people that are known to be at danger from this virus. You want to concentrate everything on protecting them. But a general population lockdown, the researchers are saying, is actually much worse than if you didn't do it.
How do you explain what's happened in New York compared to what's happened in Ontario then?
Well, that's the infection fatality ratio is going to be very different depending on the locality, depending on the culture of the place, the density of vulnerable people in a particular place, where it's spreading. So that number is going to change from place to place. But overall, and also their peak occurred earlier in the transmissivity season because it is seasonal, and ours appears to have appeared. Is now coming down, and it didn't reach the people in the homes and in the hospitals as much as it did in New York. So all of these circumstances are going to make these differences from place to place. But there's a group at Stanford of Dr. Ioannidis who showed in a very definitive way by looking at a broad study that the infection fatality ratio is comparable to the common seasonal flu, period. And so the more these studies come out, the more data we have, the more we see that the actual fatality rate is quite normal. There was the reason that people panicked was because there was an identification of a viral pneumonia in China, killed some people in hospitals. There was a reaction to that, and it just went from there. It kind of snowballed from there.
Is the comparison to the flu apt, though, when we have a vaccine for the flu and we don't have a vaccine for this?
Well, that's right. Now, the vaccine for the flu is not particularly effective. It hasn't gotten rid of the flu. But it's important to note that there has never been a vaccine that's been successfully developed for a coronavirus. It does not exist in our medical repertoire, okay? And there is experts that are explaining that there is good reason for that. Coronavirus is different, not just in its structure and the type of virus it is, but it's also different in that it's much more difficult to make a vaccine for it. That's why you've got 100 labs around the world that are trying to figure this out. But it's never been done before, and there are potentially dangers associated with it as well. So if anything, it'll take longer to do, and there's no guarantee that it'll work. Now, apparently, from reading the medical reports, the coronavirus, when it attacks, stays localized and attacks the cells inside the lungs, whereas an influenza virus will actually penetrate and go and attack cells at various organs and so on in your body. And so the immune system, the way that it can respond is different. But anyway, it's never been done before.
Denny, I certainly appreciate the time today. Thank you very much.
You're welcome. Bye-bye.